Good morning, everyone. I'm Dr. Caitlin Baston. I'm the Acting Commissioner for the Department of Health. It's lovely to see you all today. Thank you for taking time out of your days to join. I'm very appreciative of all the work that you do and of those who are willing to sign up to give testimony today. We very much value your thoughts and your input. You are our eyes and ears on the ground, and we thank you for everything that you do for public health and for the state of New Jersey. So with that, I will hand it over to Rosie and we can begin testimonies.
Thank you all again for joining the New Jersey Department of Health for our financial year 2025 budget listening session. Just going to go over some logistics briefly. Please note that we are recording this session. This is the second of two sessions. If you have signed up to provide verbal testimony regarding the budget for this session, your name will be called. At that time, please unmute your microphone and provide your testimony. Remarks are limited to 5 minutes. Once you reach the 5-minute mark, you will be muted. If you have not signed up to speak and wish to share testimony, please note that at the conclusion of registered speakers, there will be a time for you to share your testimony. We thank you all for your participation today. And now we will go ahead and begin. All right, first on the list, Kathy Rowe with New Jersey Advocates for Aging Well.
Thank you. Thank you for having me and allowing me the opportunity to speak today on behalf of New Jersey's older residents and the many more who will soon be considered senior citizens as our population rapidly ages. Within the next 10 years, it's predicted that New Jersey residents over the age of 60 will outnumber the students in New Jersey schools, and we are not prepared for this. I have 3 comments to make. And first, I want to applaud the department's focus on mental health issues. Coming out of the pandemic, we've all learned about the importance of mental health and our overall well-being. But while the department has addressed this in several specific areas, including college students, youth, maternal, rural health, and more distinct groups, the mental health of older residents is missing from your focus areas. Chronic mental health issues do not disappear with age. Hopefully, by dedicating resources to people at earlier stages of life, it will address and help alleviate mental health issues later in life. But a whole new level of issues come about with age. This includes loss, grief, social isolation, which we saw so much of during the pandemic, depression from loss of loved ones, and not to mention the impact of dementia, the strains of caregiving, and the stress of declining health. As recognized by work based on the person-centered trauma-informed care, a lifelong of trauma, whether it's one large event or a history of microaggressions, can lead to anxiety and mental health issues later in life. My second issue is the direct care workforce shortage. As we emerge from the COVID-19 public health crisis, we're facing a new public health crisis, which is the workforce shortage. And as our population ages, the need for support services is steadily increasing. With a shortage of direct care workers that includes certified home aides, certified nursing assistants, and personal care aides, the pandemic has only made this worse. I believe that we recognize the importance of these support jobs, but we're not reflecting it in the training, wages, options for career advancement, and overall respect of the positions. In order to staff and meet the demands of our long-term care, of our long-term services, we need to focus on recruiting, training, and finding ways to retain workers in this field. New Jersey Advocates for Aging Well has joined forces with PHI and with the New Jersey Healthcare Quality Institute to lead a coalition with dozens of stakeholders throughout New Jersey to find ways to improve the situation and resolve the shortage. And as we explore strategies for addressing this, we're looking at other states with successful models, such as the WIS Caregivers Training Program in Wisconsin. The coalition is here as a resource for you, and we would welcome the department's questions on how we can solve this crisis together. And finally, I want to ask the Department of Health to incorporate an aging lens on all of your work. Aging is one of the only things that affects all of our New Jersey residents, and it needs to be considered at every age and stage of life, not just at the end. One strategy to increase the focus on aging is to join the age-friendly public health systems movement. Recognizing that public health departments and systems can make important contributions to the health and productivity of older Americans, the Trust for America's Health and the John A. Hartford Foundation are partnering with state and local health departments to help them implement a public health framework within their departments and to support their health and the well-being of their older residents. We're in frequent contact with the John A. Hartford Foundation on the progress of the age-friendly public health systems and what's going on in other states. And we would welcome the opportunity to help bring this important strategy and the tools to implement it to New Jersey. Thank you for your time.
Thank you for your testimony. Next, we welcome Lori Feldstein's testimony. Is Lori Feldstein present and able to provide testimony? All right, we will move on to the next, Dr. David Burrell. Is Dr. Burrell present? All right, James McCracken, are you present and able to provide your testimony?
Yes, I'm here. Thank you so much. My name is Jim McCracken. I'm the president and CEO of Leading Age New Jersey and Delaware, and I'd like to thank you for the opportunity to speak on behalf of our association, which represents over 150 mission-driven aging services providers. We represent the full continuum of care, including nursing homes, assisted living residences, home care such as PACE, hospice, assisted living programs, as well as independent affordable senior housing and continuing care retirement communities. I have more details which I've submitted in a written statement, but just to go over some highlights. Our members continue to work extremely hard caring for older adults while dealing with ever-changing regulations, COVID-19, staffing shortages. Many of our organizations, which I'm proud to represent, have made it their mission for more than 100 years to take care of the frail and elderly in our state. I want to make sure they still exist when I or someone I know, a loved one I know, needs care one day. The number one priority of our members is making sure they have the staff and resources to provide quality care for older adults. While we greatly appreciate the support that both the legislature and administration has provided to our sector during the public health emergency and thereafter, the truth is that reimbursement rates haven't kept up with the cost of providing services, and our association has serious concerns about the future of long-term care in New Jersey. Leading Age New Jersey is appreciative that last year's state budget increased funding for nursing homes, and we're grateful for the state, and we're grateful that the state is in the process of developing and implementing a cost report rate-based system. Leading Age New Jersey Delaware strongly supports reimbursement that fairly compensates providers for the costs they submit and guarantees quality care for nursing home residents. From preliminary cost reports, we anticipate a shortfall in assisted nursing and skilled nursing is going to be approximately $60 per day. The state fiscal year 24 budget maintained a much needed tiered rate increase for assisted living residences, assisted living programs, and comprehensive personal care homes for facilities whose population had a minimum of 15% Medicaid residents. This year, in support of our assisted living providers, which all help save the state money and keep more people out of higher cost levels of care like nursing homes, we asked the state budget include further increase for Medicaid residents residing in assisted living communities and help them in order to help them age in place. Across the continuum of care, Leading Age New Jersey Delaware members continue to face extreme challenges due to the workforce crisis. Therefore, any investment in workforce development targeted specifically for long-term care would be greatly appreciated, as this is the highest priority for our members. In conclusion, I just want to reiterate that despite improvements on the COVID-19 front that came with the advancement of testing and vaccines, these are still very serious times for aging services providers and their staffs and those they care for in New Jersey. Increased funding is critical now more than ever. Thank you again for your time today, and we look forward to working with the department during the budget process. I appreciate the time.
Thank you for your testimony. I did note that Lori Feldstein has joined. Lori, would you like to provide your testimony at this time?
Thank you very much. Yes, I appreciate it, and sorry for my delay. Thank you for the opportunity to speak on behalf of the Goals of Care Coalition of New Jersey. we have built a statewide consortium of healthcare stakeholders who are committed to the mission of improving access to high quality care for people with serious illness. Our organization includes healthcare providers and systems, payers, employers, and patient organizations. Many studies have cited that by increasing access to palliative care, people with serious illness and their caregivers are more satisfied with their care, pay less out of pocket, and even live longer. Palliative care is specialized medical care for people who are living with a serious illness. And it's this type of care that's focused on providing relief from symptoms and the stress of dealing with a serious illness that has been proven to improve quality of life for both patients and their unpaid caregivers. Recognizing that increasing access to and awareness of palliative care services for people living with serious illness can have a very profound impact on total cost of care and the quality of care experience. The New Jersey Commission for Cancer Research, which is within the Department of Health, awarded a grant to our organization to study need and capacity to deliver palliative care services to patients in New Jersey with cancer. And this study, which is currently underway, will identify where, how, and to whom palliative care services are being provided in the state, and will help us to better understand and quantify the gaps in palliative care for patients with cancer. There are a number of deliverables related to this project that will occur in 2024. But the work that we are doing is critical to the eventual implementation of a Medicaid benefit for community-based palliative care service, which was unanimously approved by our state legislature this year and is awaiting feedback from the governor. It is our request from the Department of Health for the 2025 fiscal budget to provide funding to support a serious illness workforce development program. Much of the work that we're undertaking through NJCCR's grant program will provide the information we need in order to put together a directory of palliative care providers for the state so that ultimately physicians can refer patients to qualified programs, and also patients could identify providers in their own community. We're asking for support to expand and provide for maintenance of that directory, to support education and training of providers to address the unmet needs we are uncovering, especially in low capacity and under-resourced communities. We're also asking for support to develop targeted provider and patient caregiver awareness programs so that we can educate about this palliative care program and encourage referral and participation in the program. And ultimately, we would like to really leverage the academic collaborative that the Goals of Care Coalition has convened in order to assess needs and develop a plan to integrate core palliative medicine competencies into our state's medical and nursing school curriculum. So we're asking for the opportunity to partner with you, the state, to see this work through to completion and to support the people of New Jersey with access to better care while facing serious illness through increased access to palliative care services in the community. Thank you for the opportunity to present today. Appreciate it.
Thank you for your testimony. Mr. Lester Jones, would you like to present your testimony?
Good morning, and thank you. I'm Lester Jones, I'm the Health Officer for Middlesex County and President of the New Jersey County Clean Health Officials Association, an affiliate member of New Jersey Association of Counties. Thank you for the opportunity to speak on the 2025 budget listening session. I would like to just bring up concerns of myself and my colleagues around the state regarding positions that have been funded through COVID-19 and American Rescue funding, the impact that this funding will have on health department staffing and county and local health department budgets in a time have this funding. During the pandemic, we bolster our staffing in order to meet the needs of our residents. But now, as we're looking at potential reduced funding moving forward, this will have an impact on the services that are provided by local health departments. We as a county and our association continue to work with our legislative leaders to promote increased funding for public health, and we will continue to do that. Our counties have a unique role in public health as we are the stewards of collaboration among local health departments, healthcare providers, and community providers to provide services that our residents require and expect. We also play an integral role in the county master plan process, which incorporates health and wellness of our communities into projects, which encourage additional resources in open space, recreational parkland, and recreational sports facilities. We collaborate with our educational institutions, utilize their skill, base, experience, and educated professionals in providing the best public health services to our communities in a way that is cost-effective and efficient and provides a great return on investment. However, we continue to need value support both financially and institutionally of our state health department and other state departments to continue our work. So as we move through the budget process for 2025, our association remains ready to work with you through this process and hopefully maintain in the areas that we need increased funding for vital public health programs that we provide to our residents. Thank you for the opportunity today, Commissioner.
Thank you. Is Mr. Paul Roman available to provide your testimony?
Good morning. I'm Paul David Roman, president of the New Jersey Local Boards of Health Association. New Jersey Local Boards is one of 6 members of the FACE Coalition, which represents the State Department of Health recognized public health organizations. Local Boards is a de facto voice of New Jersey's over 450 local boards of health, comprised of more than 3,200 elected or appointed local board members. We are the governance component supporting New Jersey's health departments in our unique home rule system. Historically, public health professionals have worked largely behind the scenes to improve the health and safety of American communities. Today, public health and its leaders are in the spotlight. Strengthening public health systems and organizations is an enterprise of unprecedented interest. We in public health must capitalize on this interest by seeking new opportunities to assess and improve the ways we deliver public health services in our states and our communities. New Jersey's boards of health and health departments are worst in the nation in funding from state sources. Public health priority funds, which were given to local boards and departments statutorily for over 70 years, was in trouble. And in 2011, the Grim Reaper struck down the PHPF allocation, resulting in loss of staff, loss of programs, and consequently, a loss of education, engagement, and enforcement. Compared to national standards, New Jersey health departments are underfunded 3-to-1. We must reverse this trend. At least every dollar lost from public health priority funds has been painfully made up through the local tax base, property tax base. Of all the grants provided in support of COVID activities, all of them are either expired or on July 1st next year, they all go away. There is no money for foundational services and routine operational costs for our health departments. This will again result in the same condition we found ourselves prior to COVID, when we had lost personnel and programs and found it difficult to maintain New Jersey's mandated minimum standards. The Department of Health has received significant funding from CDC, but in spite of CDC's recommendation to provide direct assistance with approximately 40% of the award, those who crafted New Jersey's application saw fit to ignore the recommendation and successfully received needed funds to rebuild the state health department, which is good, and additional funds to develop regional assistance for local departments. This regional plan will not provide staff or programs and should be redirected to provide direct support to local departments. This would fulfill the statutory requirements for PHPF as it is spelled out currently in NJSA 26:2F. Additionally, under the auspices of the Public Health Council, while only an advisory body for many of responsibilities, Council has the authority to recommend that there be a plan whereby the State Department of Health budget will include a quote, special projects and development fund, unquote. This will fulfill the need to meet the standards of performance and should be considered priority health services and be provided in the form of grants to local, county, and regional health commissions. This would fund PHPF. In our annual budget address to the house, each house of the legislature, and to your testimony, my testimony each year for you, we annually offer 6 new dedicated revenue streams, which are spelled out in our written testimony that has been submitted to you for your consideration and for possible inclusion in the Department of Health or other related state budgets. With your support, we need to let Governor Murphy know that when PHPF bills S-2413 and A-4115 reach his desk, that he should sign these bills for $10 million, which will become a restored annual appropriation, including planned future COLA increases. At present, New Jersey is participating in a large regional study, national study, to determine the true cost of foundational services. The results of this study will be translated into a true future picture of New Jersey's basic needs and which would drive future PHPF needs awards. In April, in recognition of National Public Health Week, Governor Murphy showed his commitment to public health by issuing a proclamation in which he stated that, quote, strategic investments in prevention could result in significant savings in healthcare costs. By adequately supporting health and prevention, we can continue to transform a health system focused on treating illness to one focused on prevention. We in public health need action and adequate permanent funds to bring his vision to life. Thank you.
Thank you for your testimony. I will now call upon Pascal Nwaka.
Okay, can you hear me? Okay, thank you. Sorry, I'm at APHA in Atlanta. So good morning and thank you, Acting Commissioner Baston, proud resident of Camden County. So I'm here on behalf of Camden County Department of Health, New Jersey Association of County and City Health Officials, New Jersey Environmental Health Association, New Jersey Public Health Association, and New Jersey Links Health Officers Association. So just like the last speaker, Paul, and the previous speaker spoke, Lester Jones, we are all trying to get everybody's attention that can listen to public health, that we need sustained, and I repeat, sustained funding for public health. And through our public health priority funding that was taken away from us years ago, we are suggesting and really pushing it forward through a bill that we will make sure that this funding is in the state government budget on a yearly basis. So what's happening now, my practical person, is that people see that funding from COVID, residual funding, is coming through going to public health. But this funding, most of them are to sunset in 2025 and God willing, maybe early 2026. And then we're back to pre-pandemic levels. So what does that tell us? If, God forbid, we go through another pandemic or anything that looks like COVID, we will go back to where we started. We all know what happened in 2020, early 2020. Everybody was running like chickens without head, and we tried to get things together, but before you know it, of course, people died. We could have saved more lives if we were more prepared on the ground as local health departments, because we are the boots on the ground. From the time you wake up in the morning to the time you go to bed, you are impacted by what we do, public health. So it's very important that we have sustainable, again, I repeat, sustainable funding for public health so that it doesn't go away. And then we have something that we will be working with on a daily basis. It's very important to for other fundings to go into fire brigade. And I remind every people that when you go to city council meetings, you don't see the police and the fire department budget being cut, but public health is always the people that get the sledgehammer because people don't realize what we do until the pandemic struck everybody. So like I said, a practical person and practical experience. So I thank you for this opportunity to speak to you today. And I hope everybody hears our cry that we in public health need more funding to make our job worthwhile and to keep people alive. Thank you.
Thank you. I will now call up Michael Pearson.
Good afternoon, Commissioner and department staff. On behalf of the ARC of New Jersey, I just want to thank you for the opportunity to share our suggestions for the Department of Health's fiscal year 2025 budget. The ARC of New Jersey is the largest advocacy organization in the state for people with intellectual and developmental disabilities, or IDD for short, and their families. Our local chapters serve all 21 counties, 5 of which provide early intervention or EI services across the state. The ARC of New Jersey commends the Department of Health on its continuous effort to improve the lives of New Jersey residents, specifically those with IDD and their families. Of the many programs supervised by the department, the New Jersey Early Intervention System is one of tremendous importance to this particular population. EI helps children with IDD or developmental delays meet their milestones for language, gross and fine motor skills, cognition, behavior, and social emotional development. In addition, EI offers social work services, parent coaching, and other support for the entire family. It's really a family-based model, not just focused on the child. Children are only eligible for EI until the child turns 3, but the benefits of these services really last a lifetime. We were so thankful for the 7.5% increase that was allocated in the budget for the fiscal year 2024. And we recognize all of the hard work that was done by the department leadership and staff to make that a reality. While the increase showed the department's dedication to optimizing EI services for thousands of families, the system is still facing challenges that threaten providers' ability to meet families' needs. Access to timely services, which formerly was known as the No Practitioner Available list, is a major priority for the New Jersey Early Intervention System and provider agencies alike. And additional dollars are desperately needed for New Jersey to meet federal regulations surrounding this issue. We're hopeful that the department will also share detailed results of the recent rate study to support the need for this additional funding. Workforce stability remains a constant issue in EI, with practitioners leaving the field in search of better, more consistent compensation. In addition to current staff leaving, provider agencies have found it extremely difficult to attract new practitioners to the field without the same incentives that are offered by school districts and hospital-based settings. EI must be an attractive field for college students and recent graduates, so additional funding is needed to establish scholarships and incentives for pursuing a career in EI. We urge the Department of Health to again make a commitment to these families and include a 7.5% rate increase for EI in the fiscal year 2025 budget. With the window to provide services in EI being so small, only birth to age 3, we have to act now to guarantee that children receive every session of these critical therapies and services to which they're entitled. Thanks for the opportunity to share these comments today, and the ARC of New Jersey always looks forward to working alongside the Department of Health on these issues. Thank you.
Thank you. I will now call on Kathy Chin.
Good day, Acting Commissioner Baston, members of the Department of Health. My name is Kathy Chin, and thank you so much for this opportunity to share our thoughts as you begin deliberations on the FY25 budget. It means a lot to us to be a part of your process. Over the last number of years, the Murphy administration and the Department of Health broke with tradition and provided our sector with leadership and support by affording our providers with rate increases for the first time in over a decade and a half, proving that things do not have to be the way they are. EI provider agencies take on one of society's most important endeavors, minimizing and preventing permanent disability. But their ability to fulfill their mission is jeopardized whenever we fail to recognize that they are rate takers, not makers, forced to make do until the inconsistent intervention of government. As in any business, our agency executives provide strategic and operational leadership, manage services, and support and guide employees. Unfortunately, our inelastic rate system means we cannot always promptly respond to inflation or make course corrections when an unanticipated need emerges. The pandemic is a case in point. Inadequate state funding for over a decade led to shortages of EI practitioners and a lack of reserves to respond effectively during the crisis. Many opportunities for therapeutic interventions during the pandemic may have been needlessly interrupted, ended, or unbegun. The increases, which began in 2021, are helping to reverse this trend. A recent survey of ABCD's EIPA members found that the rate increases enabled them to retain most staff and, for many, begin hiring replacement workers, including more experienced practitioners. Average turnover rates since 2021 are 23% versus 10% for years prior. In part, this is a result of the pandemic, and practitioners are reassessing the field, some choosing more constancy, a job in one setting without travel, unpredictable wages due to cancellations, or simply fewer work hours. On a positive note, our members report that there are professionals entering the field as their sole income source, their career. Quote, everyone is happier. They no longer feel underpaid and feel they are valued, end quote. Truth be told, we may be in a transitional period. Though the number of children waiting for service is still well above pre-COVID levels, since and due to the rate increase on July 1, 2023, and the efforts of the state and community at large, Herculean efforts, the standby list has been reduced by 55% in just 4 months' time. But staffing pressures continue to force many EIPA members to slow their growth despite increased demand and need for services, especially in low-income and underserved communities. In addition to growing our workforce and finding new ways for care to be accessed, we need to ensure that we are maximizing utilization and minimizing overutilization of our current workforce. Government's recent actions to supply us with resources to provide high-quality service and increase and expand our work with infants, toddlers, and their families must be an enduring commitment. As you know, the human cost to infants and toddlers who do not receive timely and exceptional service is tremendous. The cost to the public purse, substantial. Please consider an annual rate increase for the EI providers of 7.5% in the FY25 budget. Thank you for your partnership helping us do the most meaningful job, which is an incredibly good job. Thank you very much.
Thank you. I will now call on Carmela Hanna.
Hello, thank you so much for allowing me to speak to you today. It's a pleasure. I'm mirroring the comments of my early intervention colleagues today. My name is Carmela Hanna. On behalf of Sunny Days, Early Intervention Childhood Developmental Services, an industry leader in New Jersey for almost 30 years. I consider myself fortunate to have worked and continue to work in a system that I am passionate about for most of my professional career of almost 2 decades now. Early intervention is a state program that delivers specialized services to families and children between the ages of 0 to 3. Early intervention assists, supports, and coaches caregivers to meet the developmental needs of their children until their 3rd birthday. Those outcomes have great potential into adulthood. Sunny Days practitioners, we We provide Sunny Days practitioners and services in all of New Jersey. We provide EI services as well as evaluation services. We continue to recruit all practitioners in all disciplines. We provide evidence-based training, supports, and other kind of things to maintain a level of excellence. Nevertheless, I want to specifically speak to you about the early intervention practitioner through their lens. They are a unique niche of professionals comprising of teachers, occupational therapists, speech and language pathologists, social workers, behavioral therapists, and others who come into early intervention with an extensive professional education and work experience in the field of pediatrics. Early intervention further refines these pediatric specialists into early childhood development experts. It is through extensive training that we refined our specialists. They are highly specialized and sought after, in so much that I've often referred to our early interventions practitioners as the first responders to early childhood development. The competition for these practitioners is fierce. Retention is equally challenging. New Jersey early intervention has seen 17% increase in referrals into our system due to many factors that include multi-level developmental delays post-pandemic, as well as long wait lists at outpatient clinics, hospitals, and other specialists. Time matters when it comes to our 0 to 3-year-old developmental window. A three-month wait list for an adult is annoying, but for a 12-month-old, that represents 25% of their life. Families are desperate to receive services for their children, and they look to early intervention for those services. However, we are losing our specialized practitioners to other pediatric settings, clinics, schools, hospitals. We are losing the retention battle. To maintain our standards of excellence and retain our highly specialized experts, we ask that reimbursement rates keep pace with industry standards to create not only a competitive, but a stable work environment for practitioners in early intervention. I also asked for a 7.5 increase in this upcoming year to continue to bridge the gap between recruitment and retaining our practitioners so that early intervention can continue to do what it does best, which is to support our families and the developmental needs of their children. With that, I conclude my statement, and I would also like the opportunity to take this opportunity to thank every single person who is involved in early intervention, especially the early intervention practitioners. Thank you.
Thank you. I will now call on Deborah Wentz.
Hello, I'm here. Hi. Hi, good morning. Thank you for the opportunity to provide input on the fiscal year 2025 budget. I'm Deborah Wentz, President and CEO of the New Jersey Association of Mental Health and Addiction Agencies. Our members serve more than 500,000 children, youth, and adults annually. It is evident that more needs to be done to address the continuing increases in mental illnesses, substance use disorders, and co-occurring disorders, along with comorbidities such as diabetes and heart disease. To address these growing areas of need and ensure equity in integrated health care, programs, projects, and initiatives within the Department of Health must be strengthened and expanded. NJAMA, as we are known, fully supports the Department of Health in its efforts to hire more staff in the Division of Certificate of Need and Licensing. This will assist in processing programmatic licensure applications quickly, as well as to approve and grant waivers when appropriate. This will also increase access to the growing number of individuals in need. Other recommendations to expand access to care include expediting the promulgation and adoption of the integrated license regulations. Also, to further facilitate integrated whole person care, provide an additional $5 million in funding for hospitals to attract and retain psychiatrists and advanced practice nurses in their inpatient units. We also call on you to invest an additional $8 million in charity care for a total of $350 million to cover the increased uncompensated care delivered by hospitals. We would like you to continue to expand harm reduction centers to all 21 counties so that these life-saving services that meet people where they are become available to all New Jerseyans who need them. To achieve this critical goal, the funding for harm reduction centers needs to be doubled to $9 million in the fiscal year 2025 budget. We're calling on you to provide incentive funding for community providers to participate in the Quality Improvement Program, QIP. This initiative requires collaboration of hospitals with community-based behavioral health care providers, yet funding for community providers is not included in the QIP framework. The department should consider separate state funding to incentivize community providers to work with the QIP hospitals for the benefit of those served by these programs. We're calling also on DOH to provide an additional $5 million for the graduate medical education budget line and an additional $5 million for the graduate medical education supplemental budget to encourage an ongoing pipeline of future healthcare providers, including behavioral healthcare providers, to address the workforce shortage long-term. Please also provide funding to ensure that all healthcare providers continue to have personal protective equipment. In addition to funding for these needs throughout the healthcare system, NJAMA recommends increased fiscal resources for the following specific services: to increase the number of inpatient beds, particularly for children and youth; to continue the hepatitis initiative, which currently includes $3.7 million for hepatitis C treatment for offenders with substance use disorder and $4.5 million for hepatitis C testing and treatment of state inmates, as well as an allowance of up to $10 million more for the latter from the institutional program support budget line. And we call on you to continue at least level investment to combat the HIV epidemic. All of these investments are necessary to deliver the timely and appropriate care that all New Jersey's residents need and deserve to thrive. Thank you so much for this opportunity to share our input today.
Thank you for your testimony. I'll now call on Shadiah Bennett.
Good afternoon, Shadiah Bennett, Director of Government Relations and Policy for the New Jersey Hospital Association. On behalf of our more than 400 member organizations, NJHA appreciates the opportunity to offer testimony as the department develops its plan for the state fiscal year 2025 budget. We thank the department for its continued partnership on improving the health of New Jersey residents, and we appreciate the support you give to our members every day, which allows them to provide the highest quality of care to the patients they serve. We greatly appreciate this partnership. However, our hospitals continue to struggle financially. According to our recent 2022 data, the average operating margin for New Jersey hospitals was 2.6%. 42% of New Jersey hospitals had operating margins below zero in 2022. There are several factors that contribute to these financial challenges. These include rising costs. The cost of healthcare is rising faster than inflation, which is putting pressure on hospital margins. Declining reimbursements. Hospitals are receiving lower reimbursements from insurers, which is also squeezing their margins. Increased competition. Hospitals are facing increased competition from other healthcare providers, such as urgent care centers and retail clinics. The aging population. The aging population is driving up demand for healthcare services, but it is also leading to higher costs for hospitals. One of the most significant challenges facing hospitals is a shortage of healthcare workers. This is a result of an aging workforce, a growing demand of services, and changing healthcare needs. The impact of this shortage can be felt throughout the entire care continuum, as the demand for care is outpacing supply. To keep up with demand, the current number of primary care providers in New Jersey will need to expand by 1,116 by 2030. New Jersey also needs an additional 11,400 nurses by 2030. Despite these challenges, hospitals are dedicated to caring for patients, regardless of their ability to pay. New Jersey hospitals provided $544 million in charity care services to New Jersey's underinsured and uninsured residents in 2019. This underestimates the full cost of care, since New Jersey's Medicaid reimbursement rates are well below the actual cost of providing care. In SFY 24, New Jersey hospitals were reimbursed at $342 million. NJHA requests that the state maintain the financial viability of the charity care program by fully funding the subsidy. The program serves patients while providing the necessary reimbursements to hospitals to ensure the financial stability that allows their doors to remain open. For SFY 2024, fully funding the charity care program would have cost the state $214 million. With a federal match of 1-to-1, this would be a total of $428 million. Thank you for the opportunity to submit this testimony.
Thank you. I'll now call on Axel Torres Marrero.
Buenos dias, good morning. Axel Torres Marrero, Senior Director, can you hear me? Senior Director of Public Policy and Prevention at Hyacinth AIDS Foundation. So again, we have provided written testimony, so I won't go through all of it, but we at Hyacinth, we welcome the opportunity to testify today regarding the ongoing fiscal needs of the vulnerable constituency that we serve. There is no doubt of our ability to end AIDS in our lifetime. We all know that the road before us will not be easy, and it does require a sustained commitment and additional resources. New Jersey is very fortunate that our Department of Health remains committed to ending the epidemic by focusing on 3 key goals, which is eliminating the number of new HIV infections by promoting access to testing and promoting linkages to care. Today, we want to ensure that the budget proposed includes, at the very least, level funding to support the commitments, to support all of the goals included in the strategic plan to end AIDS in New Jersey. Hyacinth has always been at the forefront of syringe access and harm reduction program development and policy advocacy. We know that these programs remain underutilized in New Jersey. Harm reduction centers provide free sterile syringes, an approach that reduces the likelihood that users will share injecting equipment. Although these programs are extremely beneficial, they are underutilized, and they offer a range of health services and supportive services, including on-site medical care, screening for HIV, hepatitis C, and sexually transmitted diseases. They also administer naloxone, which rapidly reverses opiate overdose, saving countless of lives in the process. New Jersey must continue to support these programs, expand them throughout the state, and increase the funding overall to truly meet the needs of the community. We also want to be able to talk about today about that as we work towards ending the HIV and hepatitis C epidemic in New Jersey. We agree that no one should die from a preventable overdose. The time has come for New Jersey to provide additional funding and expand overdose prevention centers to reduce the risk of drug use, overdoses, and unwanted public use. OPCs help bring the public drug user indoors. Participants bring their own drugs. Trained staff provides sterile syringes and intervene if an overdose does occur. These centers go a long way in addressing community concerns regarding public drug use. New York City has opened 2 of them so far, and Rhode Island is expected to open one by 2024. New Jersey must do the same. All the studies demonstrate that OPCs are effective in reducing overdoses, increase access to primary care and other services, and promote safe injection practices. They reduce HIV and hepatitis C, skin infections, and very importantly, reduce the syringes found in the community, reduce crime and drug use in public. Lastly, we would like to talk about the need for additional funding for housing. As we evaluate our collective efforts to end HIV in New Jersey, Hyacinth Days Foundation must continue to advocate for additional funding for housing for people living with HIV or at risk for HIV. Housing status has a direct and powerful impact on HIV incidence and on the health of people living with HIV. Homelessness and unstable housing are linked to greater HIV risk, poor health outcomes, including high viral loads and other comorbidities. Again, we want to stress that someone with a high viral load can pass on the infection. An individual who is undetectable literally cannot transmit the virus. The goal in ending the epidemic is to get everyone who is HIV positive to be undetectable, and those at risk never to become HIV positive in the first place. Whatever factors make someone in New Jersey vulnerable to HIV infection, homelessness, and housing instability magnifies those risks. Whatever factors lead to disparities in care for women, sexual minorities, people of color, or those who experience mental illness, addiction, violence, abuse, or incarceration, housing instability amplifies these disparities in tragic and avoidable ways. We caution at Hyacinth Days Foundation that any plan to end HIV in New Jersey must include a significant investment of funding for sustainable housing. I repeat, not the current funding, but an increase in the investment of funding for sustainable housing. We can no longer deny the simple reality that without appropriate, stable housing for people living with or at risk, we will never end HIV in our state. As always, Hyacinth Days Foundation is committed to working with New Jersey's Department of Health on all of these issues. We remain optimistic that together we can end HIV and hepatitis in our lifetime. I thank you.
Thank you. Next, I'll call on Helen Hukis.
Good morning, Commissioner Baston and members of your leadership team. Thank you for this opportunity to provide input on the 2025 budget process. My name is Helen Kiokis, and I'm the Policy and Advocacy Manager for the Camden Coalition. We are a multidisciplinary nonprofit working to improve care for people with complex health and social needs in Camden, New Jersey, and across the country. As one of New Jersey's 4 regional health hubs, we also function as a strategic planning partner to state agencies, whether that's through program design, conducting community needs assessments, or designing population and patient-level health interventions. We serve as a bridge between state agencies and local stakeholders in South Jersey and work to inform policymakers about local issues impacting Medicaid beneficiaries. We want to thank you for continuing to invest in programs to fight the opioid epidemic, reduce maternal and infant mortality rates, bolster the healthcare workforce, and fund FQHCs for uncompensated care, among so many other initiatives that make New Jersey safer and more equitable for all. While the COVID-19 pandemic health emergency expired this past spring, we hope DOH will continue to invest in local public health infrastructure, which would allow us as a regional health hub to continue our vaccine outreach work and our engagement on other public health issues across 5 South Jersey counties, including 2 of the state's most underserved counties, Salem and Cumberland. Additionally, we are requesting for the department's continued investment of $5 million for the Camden Coalition's Pledge to Connect program, which will allow us to sustain and scale the important work of connecting individuals who show up in the emergency department with behavioral health needs to outpatient community-based behavioral health care. With previous funding and support from the Department of Health, the Camden Coalition and our partners have been able to reach over 3,000 patients, reaching patients of color at a disproportionately higher rate and improving access to outpatient community-based behavioral health services. In recognition of these initial findings, we were awarded SAMHSA's 2023 Behavioral Health Equity Award for program effectiveness and engagement with communities of color and underserved populations. We're excited to build upon this work. a $5 million commitment in the department's 2025 budget, which is a flat funding request, will enable us to scale Pledge to Connect to other parts of New Jersey and create a national model for ED-focused behavioral health transitions of care. With your continued support, we'll be able to guide other health systems and CCBHCs that want to implement Pledge to Connect model. We can monitor patients and operate a regional community-based transition of care team. And we can leverage our health information exchange to present a data integration roadmap, since behavioral health data are not available to health systems. Along with a written copy of our statement, we have submitted additional information about our Pledge to Connect program and the successes of the program thus far. And also it outlines the work that the Camden Coalition and our partners will be able to do with an additional $5 million investment from the department. Again, thank you for this opportunity and for all the work you do on behalf of New Jersey residents, and we look forward to our continued partnership.
Thank you for your testimony. I'll now call on Stephen Labuti.
Thank you, and thank you for the opportunity to testify today. As director of the Rutgers Cancer Institute, I want to thank the governor, the state legislature, and the Department of Health for its continued focus on the investments in healthcare services and the nation-leading research that takes place throughout New Jersey. I would first like to update you on the progress that has been made at Rutgers Cancer Institute, thanks to the state's ongoing and growing financial commitment, and then turn to what I believe is the future of cancer treatment, namely cellular and gene immunotherapy, and request your consideration of additional support for this cutting-edge program. As New Jersey's only National Cancer Institute designated comprehensive cancer center, Rutgers Cancer Institute of New Jersey is dedicated to conducting oncology-focused research and translating those findings to the latest evidence-based care, innovative clinical trials, and community outreach to the state of New Jersey, which ranks 6th in the nation for cancer incidence. State support of the Cancer Institute has been and continues to be critical for maintaining stability and launching innovative scientific and high patient impact initiatives. Fueling our efforts have been unwavering bipartisan support and consistent line items in the annual state budget since 2003. $53 million in the FY24 budget supported the restructuring of our clinical trial enterprise, resulting in statewide integration and a 93% increase in patient accruals, among other successes. State support of our clinical trials work in the Newark community has enabled us to make these life-saving studies more accessible to underserved populations there. State appropriations resulted in the Rutgers Cancer Institute achieving its highest score ever in its recent competitive renewal of its NCI designation. New Jersey is now home to a cancer center that was rated exceptional, along with others such as MD Anderson and Memorial Sloan Kettering. The foundational state support of $33 million per year is critical to translating our most visionary science into treatments. Annual state appropriations of $10 million support our Pediatric Hematology Oncology Research Center of Excellence, one of only a handful of such centers in the nation focused on childhood cancers, and the state's increased funding from $2 million to $4 million of our statewide cancer prevention and screening program, ScreenNJ, in fiscal year 22, enabled the expansion of screening for colorectal, lung, and other high-risk cancers across all 21 counties of the state. Cancer treatment has been revolutionized by harnessing the body's own immune system to fight cancer, a strategy known as tumor immunotherapy. There is no stronger example of this than the use of genetically engineered immune cells, primed and targeted to treat a patient's tumor. While significant progress in this area has been made in the treatment of blood cancers, the same is not true of solid tumors, which represent 85% of the cancers we see in our patients. The Cancer Institute of New Jersey has rapidly become one of only a handful of US institutions capable of driving this type of research. We are positioned to advance Rutgers University and New Jersey as one of the leading innovation resources and destinations for cell and gene immunotherapy for solid tumors. We are respectfully requesting an additional $5 million be awarded in the governor's FY25 budget to support our cell and gene immunotherapy program. This additional support is critical to providing needed access to advanced therapies for solid tumors for all patients who may benefit from this strategy. Within a year of its establishment, our cellular and gene therapy program has already advanced 2 technologies from the research laboratory to FDA investigational new drug applications and first-in-human clinical trials. To continue to support the growth and impact of this program, a sustained source of funding is necessary. The cost of this personalized cell product therapy manufacturing is estimated to be at least $85,000 per patient. This includes not only the actual inpatient and outpatient care, the manufacturer of the treatment, but also patient travel, recruitment, and screening. It is our mission to make these clinical trials accessible to all patients, regardless of their ability to pay. Early investment in this cutting-edge program will draw biopharma partners and will provide a competitive advantage for Rutgers Cancer Institute and Rutgers University in grant funding applications that will propel the program in the future. It will also accelerate discoveries in our field and position the state of New Jersey as a national biotechnology and clinical research leader. Thank you for your consideration of this request.
Thank you for your testimony. I'll now call on Josie DiMaria.
Thank you for this opportunity to speak to the committee today. I greatly appreciate that. I'm representing the Vineland Public Schools. I'm the nursing supervisor, as well as all the nurses of Cumberland County. We are an underserved county in the state of New Jersey. I wanted to specifically focus on our youngest population, our students in our schools and communities. There is an ever-increasing number of chronic diseases, asthma, diabetes, to name our 2 most critical. I really would like the New Jersey Department of Health to reconsider reestablishing the New Jersey Pediatric Asthma Coalition. This was a vital service that provided education to both primary care providers as well as families, and were able to develop an asthma action plan that greatly followed the GINA guidelines for asthma. Currently, there's a big deficit in asthma treatment and education, especially in our underserved counties in New Jersey. Along that lines, we also have a high undocumented population. And New Jersey Department of Health requires TB screening of these students coming from these underdeveloped countries. It would be greatly helpful if our local health departments could be screening these children for TB in their local health departments, such as the Vineland Health Department, the Cumberland County Health Department, the Camden Health Department. Some of these services are not present in all of the health departments, and especially the ones that have transportation and are underserved. That would be a great help if those services could be offered at the health departments. Lastly, we are on the front lines. Our school nurses have been on the front lines with COVID, doing all the contact tracing. And we do have a lot of staff that have left school nursing, and it is often in these communities that the school nurse is one of the few health providers that a student and family regularly communicate about health needs. We do work closely with the health department, but we see these children on a daily basis. So any more support from the health department, if they could reach out to our governor and our Congress to advocate for the 1 nurse in every school building. There is a bill currently in session. If we could ask you to also advocate on our behalf for that. And I would like to again thank you for the opportunity to speak on behalf of all the school nurses.
Thank you for your testimony. I'll now call on Saul Bautista. Sol Bautista, would you like to provide testimony? All right, moving on. Is Mr. Tomas Felix available to provide testimony? Mr. Tomas Felix? All right, that concludes our list of registered speakers. If you would like to provide testimony but have not registered, please let us know at this time by either raising your hand in Zoom or by making a note in the chat. Seeing none, that concludes our hearing for the day.
Thank you so much, everyone, for your time and participation today. Appreciate your work.